Date, December 11, 2018. Time, 9 a.m. Procedure, LASIK both eyes distance. What are you going to do with your glasses once you're done with surgery?
Throw them out.
You don't have any more contacts left either for the year?
I got one more set, just in case.
One more set.
I don't ever need those again either.
Right.
And the gown too?
Yes.
Okay.
The gown, yes. Prepping the patient. After the patient checks in, we bring the patient into the exam room to give them the proper attire to wear for the procedure. Booties, cap, and gown.
The end of the year, boy. Yeah.
Operating room. Let's take a step into the operating room. In the operating room, once the patient is ready and prepped, we ask them to lay down. They are then positioned to fit appropriately under the laser machine. Laser calculations. With the testing done at the time of the consultation, the technician uses that information to program the laser machine according to the doctor's findings. Let the surgery begin. After the technician has the calculations ready, Dr. Epstein will step into the procedure room. Dr. Epstein's first step is always to greet the patient, at which time he will go over any questions or concerns. Next, Dr. Epstein applies the numbing drops. After the drops have been applied, the doctor then adjusts the patient's bed to fit appropriately under the laser machine.
Just a touch downward. Good deal. Okay. Low suction.
Let's go under. Let's start with the femtosecond laser. The ultra-short infrared laser pulses of the femtosecond laser can be applied precisely and predictably with minimal collateral tissue damage, making it an ideal tool for highly precise ophthalmic surgery. Flap creation laser in situ keratomyolysis is the most common use of this laser. 2. Adjusting the patient for the flap to be created. And 3. During this time, patient is to follow instructions from the doctor, staying still and keeping the eye open. Suction. After the adjustment is made, suction is turned on the femtosecond laser machine. Patient is placed under the laser machine to suction the cornea. After suction is successful, he is brought back to the Vizx to check the eye. Creating the flap. Staying still. Dr. Epstein gets prepared to shift the patient over the Vizx laser machine, which allows him to check to see how the flap is doing. Caution. The next slide contains graphic images.
These techniques are what we got. Laser. Right now.
Zap, zap. After the flap has been created, Dr. Epstein then pulls the epithelium down to center the laser in the middle of the eye. Left eye. First eye is all done. Average time per eye is 15 minutes. We will repeat all of the steps for the second eye. All done. After the procedure, the patient steps back into the exam room with the doctor. At this time, the doctor checks to see if everything went well with the surgery. Doctor will then go over any questions and medication as well as your follow-ups. Yay, we finally get to say bye to Steven, and he is on his way home after his surgery. 1 day post-op. 2020 on his 1 day post-op, patient states his vision is excellent. This paramedic firefighter is ready to go back to saving lives.